It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
In addition, we have back from sabbatical, PA Lydia, everyone. Hello, PA Lydia.
Hello.
And she's, anyway, we'll talk about you in a minute. And NP Mel B, also back from sabbatical.
Hello.
And you brought your guitar, right?
I did.
Okay, we're going to do that when we record the podcast. So the Sirius XM folks won't be
Tortured.
subject to that. Yes. This is a show for people who never listened to a medical show on the radio. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for medical news, podcasts, and stuff you can buy I can't mention contractually. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on the show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Don't forget Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And check out my work on Normal World with Dave Landau. I just did one on fecal transplant that literally derailed the rest of the show.
I was driving here thinking about fecal transplants.
Oh, really? Were you just thinking about these
I don't
things
think
randomly?
They're that disgusting. I was just,
No.
I was just thinking about it.
Well, one of the points I made was first off, how are you going to make money off of it? Because you're using people's literal shit.
Mm-hmm.
But then, how are you going to do the clinical trials? It's like, oh, hi, you're depressed. Can we take someone's liquid stool and shove it up your rectum and just see if something happens? And so it's a little bit difficult to do those, although there is a company in Canada, of course, that sells artificial stool called Repopulate. And I don't know if it has, because it is artificial, it's just bacteria, a colony of bacteria, whether it has as much beneficial effects as actual stool from somebody.
You wouldn't think so.
I wouldn't think so, because there are nerve cells in the gut. It's called the enteric neural pathway or whatever, but it's called the second brain. And when there's inflammation in the gut, it actually can affect your mood and things like that.
Oh, yeah.
And if you take stool from one person to another, you can affect their mood. And I just wonder if the Repopulate would actually do that. I doubt it, because it didn't come from a human being.
Yeah, and it'd be less likely to elicit an inflammatory response, right?
Well, true, that too. Yeah, this stuff is supposed to improve inflammation. People with Crohn's disease or ulcerative colitis, there's actually data for that. They started out just using it for pseudomembranous colitis, aka C. diff, Clostridium difficile.
Used it for that.
Yeah, and for the refractory cases of that, you can take healthy stool bacteria, give somebody an enema with it, and it actually can resolve the problem by just replacing the bad bacteria with an overwhelming amount of good bacteria. But then they found that people they did that who had ulcerative colitis actually got better too. So there's some decent data for that.
Right on.
Mm-hmm.
That's good stuff.
So just, shitting in a bucket and then adding a little saline to it and then giving somebody, an enema. It's unbelievable that actually would have some effect, but it does.
That's great. Hey, speaking of shit in a bucket, I've got a bucket full of shit for you out in my truck.
Oh, you do?
I did. Yeah, I cleaned my koi pond. I scooped you off some super duper
fish
koi poo.
Yeah.
Is that good for
the garden?
plants?
For the gardens, yeah.
Yeah,
Nice.
It's good for the garden.
I've got him a fancy little bucket out there full of fish.
I'm growing nothing but soybeans this year, so I'm replenishing my soil. So that'll be good for it.
It'll be great for
Yeah,
it.
thank you.
Certainly.
All right, good deal.
Right on top.
So anyway, check that out on Normal World. That was fun. But yeah, at the end of that one, They were so distracted by my 3 minutes of talking about fecal transplants, it just completely derailed the show.
Funny.
And that's sort of my goal. The first one I did was on Fournier gangrene, because they asked me what's the worst way to die, and I said, oh, there's one answer for that, and it's Fournier gangrene. And do not Google image Fournier gangrenes, Fournier
Space.
right, space gangrene. And it disturbed them so much that it again derailed the show for a while, and they kept trying to move on and kept coming back to it. And if I had known it was going to have that effect, I wouldn't have made my second one deviated septum, but I'd already had it in the can, so to speak. So, but anyway, all right, check that out. Normal World with Dave Landau. Dave is the sweetest, nicest person in the business. And I know some really nice people in the business, and they would all say the same thing. So he's just great to work with. And Allison Lerman, who used to work for Compound Media, she's been my liaison over there. And Angela Boggs, I might as well give everybody a shout out. Bryce and Ken and Sam and all the people that work on that show, they're just wonderful people. So it's really fun to work there.
Cool.
Anyway, be nice to make some money off of some of this stuff at some point, but that's okay. The reason
we're making money.
No, like I'm saying, it would be nice. It would be nice.
We're on a 20-year plan.
Right. What I'm hoping is someday one of these people will become so famous that they'll put me in their movie or something like that.
That'd be cool.
Yeah. Actually, Pete Davidson called me.
Yeah.
Said, if you can be up here on Thursday, I can put you on my TV show. We've got a place for you. And it was like, see, I can't just, I just can't do that. His lifestyle, he can just pick up and go, hey, we need you for a commercial on Friday at midnight. And it's like, okay, no problem. But I can't do that. So that was a missed opportunity
to do.
Yeah. I hated that. I really wanted to do it.
Well, that'd be fun.
Anyway, I now have an IMDb page now.
Oh, I don't even know what that is.
There you go. See, that's how important it is.
I'm so excited to be in the presence.
That is awesome, isn't it?
Someone with an IMDb.
He's a DB pager.
What was crazy was Tacey had one way before me, and because of I probably shouldn't. You know what? I got to go back.
Check the one.
Hang on.
He's gonna read. Well, that must be serious.
No, she doesn't want to. And could I be more redundant? I said now twice. The Department of Redundancy Department. But anyway, yeah, because of my acting work on Normal World, I have an IMDb page.
Congratulations.
I know. And Mel B doesn't even know what it is, and it's fine. That's how unimportant it is. But it was kind of cool.
Sounds highfalutin.
It's the Internet Movie Database.
Ooh, God.
So if you've ever been in a movie, even if you've been a bit, if you've gotten a credit, you end up on the IMDb. It's just a database. Well, it's kind of cool. And I'm on there as Dr. Steve, which was good. All right. Well, let's move on. Enough about me. A couple of things. I've had people reach out to me about Lady Di, in other words, Diana Orbani. She was a regular on Opie and Anthony. She was beloved, but frustrating because she was an alcoholic, and she was just a degenerate alcoholic where you could never get her to stop drinking. And at the end, after O&A went away, she would call our show when we were taking live calls, and I would say, Diana, are you calling from rehab? And she's like, oh, no. And it was click. I had to hang up on her because she had made a promise that if I paid her rent 2 months in a row, because she was getting kicked out of her apartment, and I talked to her landlord, she's going to go to rehab. Will you just hold her apartment? We'll raise the money to keep it because I just don't want her to be homeless again. And he said, yeah. And he was all in. And then she just never went. And so, we just couldn't keep doing it. And, but she eventually was diagnosed with Wernicke-Korsakoff syndrome, which I'm going to be doing a video on that very soon for my, Weird Medicine one-shots. I did one on borderline personality disorder.
Ugh.
I'm going to do another one on Wernicke-Korsakoff syndrome, but it's a dementia. Ultimately, it's a dementia that's caused by thiamine deficiency. And sometimes, even if you supplement them with thiamine while they're drinking, they still get it because the alcohol and the changes in their liver make it impossible for them to actually absorb the thiamine. And but anyway, we found out as a fan base because she called. It was either Opie and Jim or Jim and Sam. And it was like, oh, we haven't heard from you in a while. She said, yeah, I'm on a naval ship. I'm in the Navy. And then that's when they realized, we really can't take her call. She can't even give consent to be on the air. And well, that was the right thing to do.
Sure.
So it was fun making fun of her, and everybody and she was a good sport about it until she became seriously ill, and then it wasn't funny anymore. And it wasn't funny anymore before all of this, because she just wouldn't stop, and she was homeless, and she was blowing hobos and stuff. I mean, there's videos of her. I'm not speaking out of school, so it became very sad. But I have good news. I talked to her son. She's doing extremely well. She's in a nursing facility, still with dementia, still thinks she's on a naval ship. That she was in the Navy, and that was the one thing in her life that she was kind of proud of, even though she was discharged from the Navy. But she did serve her country, and she was very proud of her service. So that's kind of what she's gone back to. So, and so that's the good news. There is a GoFundMe. If you go to my Twitter feed, I posted a GoFundMe link. Her son raises a little bit of money for sodas and treats and stuff like that she enjoys.
Good.
And God bless Lady Di. Anyway, there you go. Now, Lydia, you haven't been here in a while.
I know, guys.
So
I've been everywhere, man.
PA Lydia. Oh, we could do that song at the.
I've been everywhere.
Yeah, we could do that, and Lydia could sing it.
I don't think I can get all those words out of my mouth.
I know. Yeah.
That's a lot of words.
You got to get closer to the mic too.
Yeah, I'm sorry.
Scott. That's okay. Just pull it closer. So Lydia, we were doing the saga of your breast implants.
Oh yes.
And that is complete.
It's complete.
And you look. I love this new sort of paradigm with you wearing the sort of sundress, because you always, that's not really a sundress, is it? What is that? What do you call that?
I guess it would be a sundress, just like a linen dress.
You always said you couldn't wear sundresses before.
Yeah.
And now you can, and you wear it very nicely.
Do so much. Thank you very much.
Yeah. So you're just showing.
Very, very pleased.
You paid money for it, and you're showing it off. Good for you.
Yeah.
Yeah. So how has it changed your life? Do you?
Yeah, well, I can buy bras and underwear that much.
Okay, that's
now.
not what I'm
I'm just
talking
kidding.
about, but-
I know. So certainly
cares.
certainly some confidence. Listen, don't boo me. Certainly confidence for sure.
Yeah.
It's really funny with different interactions. I'm going into a different profession now.
Yeah.
More like.
Well, they didn't know you from before.
They didn't know me from before, right? So now the people who know me, like, have had like supervisors and current bosses say, oh, I wonder how you got that job. As they unbutton
get
your
out
shirt.
of here.
It's so freaking weird, but I don't care.
That's horrible.
Yeah. So, I mean, overall, 100% positive.
Yeah.
Totally
yeah.
good.
Cool.
Yeah.
Do you have to go, oh, hey, my eyes are up here to people now?
No, I just let them look,
Yeah. Because sure.
I'm not that revealing when I dress,
You paid good money
but
for it.
whatever.
No, you look great.
Thanks.
You look great before, but you look great.
Any pain?
No.
Any residual pain?
No.
Cool.
No. Do you have sensation?
Yeah.
Yeah.
If anything, heightened sensation
Really?
in like a positive way.
Yeah. I wonder if
Yeah.
that's psychological.
No, I don't think so. I
I
mean,
think it's physiological.
yeah. And the physician, I spoke with the surgeon about that, and he said some people don't regain sensation, others do report a heightened sensation.
Well,
So,
good. All right.
yeah.
New nerve endings are made after the surgery, I guess.
I guess so.
Maybe.
Mhm.
Nice.
Way to go.
Yeah, it's good.
Mel
Highly
B.
recommend.
Yeah. Okay, good. And Mel B, how are you, my friend?
sleepy.
Are you sleepy?
Yeah.
Okay. Yeah, you've had quite the time. I don't know if you knew, PA Lydia, Mel B had her thyroid removed,
Oh,
and we
goodness.
showed pictures on here and got a content
That's
strike.
awesome.
Wow.
Yeah, it was pretty. It was an
show
impressive
you pictures.
thyroid.
Was it a
yeah.
large thyroid?
Yeah.
Oh,
Well,
my
it was a
goodness.
large nodule.
Yeah. Oh my goodness.
Yeah, it just looked. It was sweetbreads, is what it is. I mean, I could just say, this is what sweetbreads look like.
Yep.
People, if I was a chef channel and I put that exact same picture saying, "Here's what we're cooking up today," YouTube wouldn't have had a problem with it.
No,
Mm-hmm.
But anyway,
Oh,
it's awesome, isn't it?
oh,
Now
wow.
that is a nodule.
It's
Yeah.
nice to see the lobes of the thyroid and that nodule.
yeah, and that's something.
It's impressive.
Ugh.
I could still mostly swallow.
Okay.
You swallow the
Yeah.
one side, can you?
So I do want to make one announcement, and this is just for the people who know. So those who know, and those who don't, it's okay. I just want to thank everyone for the support from every corner of this universe. It's really humbling, and it's so appreciated, and it's never going to be taken for granted. And I'll explain to you guys later what I'm talking about. But like I said, those who know. Anyway, so we were going to talk about gross things and drug shortages and stuff like that. I've got a couple news stories, but before we do that, actually, PA Lydia has a story. Tell us about this massage and give us the background. This sounds crazier than hell. This kind of crazy massage. So
Yeah.
tell us about this.
Yeah, we were just chatting because prior to the show, we were talking about old school massage parlors that gave happy endings or
Right, and
manual relief.
They
and
said
so
manual relief. They had
Yeah,
signs out
it
there.
uncovered this suppressed memory that I had from about a month ago.
No.
So I got tired of paying for the expensive massage because it's like you might as well be asleep, right?
Mhm.
I want that like good deep tissue,
Mhm.
for less.
Yeah.
So I've been going to this local place run by a female and male. They're Chinese. They don't speak any English, so we communicate through
through dollars.
dollars
Yeah,
and
the
Google
cash, yeah.
Google Translate.
Okay. Yeah.
And they do. I had been a few times. They did a great job. Very intense. Like they'll have you hang from like a pull-up bar.
Okay. This
and-
is the part.
anyway.
This sounds like something from a
But with clothes
Eli
on.
Roth movie.
But
where
with
you're
clothes
hanging
on.
from these bars.
Yeah, they
Mhm.
really like stretch you and all this stuff.
Okay.
So anyway, I go back, and this time the gentleman is going to be their
Masseuse.
masseuse.
Mhm.
And so I'm like, okay, well, it's not weird. I'll be okay with that.
Mhm.
So anyway, I'm lying in
Oh,
the
yeah, is that
room
professional?
that's lit with cheap Christmas lights, and he. So when you get a massage as a female, you normally will take your top off, right? You don't wear your bra, and you just keep your underwear on, and then you're always covered.
Hmm.
Do you
I
not?
thought I was supposed to get naked.
Oh, you get naked?
I do.
Oh, well,
Just take
see,
it all off.
she's not going to be disgusted by this story.
Well,
So
there you go.
anyway, he starts getting started,
Yeah.
and he just pulls down my underwear and gets on top of me,
What? Oh,
and
what?
just like straddles me on the table, and I'm
Now you
thinking,
face up or face down?
I'm face down,
Okay.
yeah, face down. He's on top of me on the table. This is just and so I'm getting the feeling,
Yeah.
and I'm like, I don't want to be rude. I want to accept the massage,
Mhm.
but so I have to. I keep drawing new lines
Excuse
for
me.
myself.
Can you ask a question though? Like, is this part of the normal massage?
He doesn't understand that.
Oh my god.
He doesn't understand
That's
that.
that's
Weird,
an
man.
excuse.
That's
So you
weird.
literally can't talk, right?
Yeah.
Yeah.
And so then I keep making these new boundaries for myself. And if anybody knows me, I have a difficulty with boundaries.
Yeah.
So I'm thinking, okay, if I feel something, I'm
Mhm.
definitely going to get up.
I'm crawling out of here.
Like I know if I feel something,
Yeah.
I'm going to get up.
Yeah.
But it ended up just being like a really intense massage of my
Wow.
butt.
But did it have to be skin to skin though?
And yeah, I was gonna say,
I mean,
can't
were you
do-
wearing like thick felt underwear?
Granny
No,
pants,
I
yeah.
wasn't. I was wearing like
Yeah.
no, like bikini
Yeah,
underwear.
Yeah.
Cheeky bottoms, not a thong. It wasn't like pull me down.
Yeah.
See, fabric gets in the way though.
Yeah, it does. I know.
Yeah,
I
I
would
think it was
say-
the combo of like pulling it down, which was the first for me,
And climbing on
and
top.
climbing on top of me,
Yeah.
and definitely having a full view of all of my privates.
Yeah.
That was a bit awkward. So anyway, I left, and I'm thinking I'm never going back,
Yeah.
but I still left the tip. So my friends
Sounds like he left the tip.
give me so much shit because they're like, "You tipped him."
That is bizarre, dude.
So I'm gonna go back to the other
place
more expensive
where
place.
they don't straddle you.
Yeah.
Well, I've seen these massages in other parts of the country where everybody's naked and then they're just taking your limbs and bending them
Mhm.
ways that they're not supposed to, and then they're slapping you and doing all this stuff, and it's supposed to be good for you, but
Well,
Yeah.
now
I
that
like
sounds
that.
like that sounds like you're describing kind of a Thai massage.
Or Turkish too.
yeah, Turkish. I think it's a
Yeah.
Turkish
Yeah.
Because
massage.
Thai massages are really aggressive. They're stretching, kind of almost like a yoga kind of
Yeah.
stretch and massage, and it's really aggressive. They like start at your toes and start manipulating and like
I
manipulating.
think I would like that.
It's actually
Mhm.
wonderful. Yeah, that's those I love. But I don't think I
if
don't think I would
somebody's-
love somebody straddling me.
Yep.
And
Pulling
No,
my
thank you.
underwear,
pulling my underwear down first. That's just
pulling my underwear
bizarre.
down and then climbing on top of me. No,
Yeah,
thank
that's
you.
It was the
that's-
feeling.
Yeah.